Okay, I know that we'll have people join us, of course, in a rolling way, I'm sure, as people pivot from previous meetings. As you heard, this meeting is being recorded, and again, welcome to everyone. Today, I have the pleasure of speaking to you about us launching a CND OHT territorial acknowledgement. On behalf of the OHT, I want to acknowledge and thank Mackenzie Taylor, our student intern with the OHT, who thoughtfully prepared this acknowledgement. I would also like to thank and acknowledge Indigenous elders in CND, Indigenous partners at the Region of Waterloo, and partners at Wellbeing Waterloo for their contributions to shaping this work. We look forward to continuing to learn and grow in this space. I'm sure many of you would agree that there's lots of discussion around land acknowledgements and territorial acknowledgements. There is discussion about, is this tokenism or is this true engagement, and what does it mean? And one of the things that I've been very happy with and proud of our OHT is that we've really thought about this territorial acknowledgement and its use. And to us, we wish to demonstrate respect for Indigenous people and their land, to assert that we live and work on land that was taken against the treaty agreement, and to remind us that the origin of the work we do is part of a European colonial history in Canada, and we need to acknowledge that construct. And again, really want to acknowledge and thank the OHT staff support team who acknowledged with local Indigenous elders in the creation of the territorial acknowledgement, and for their commitment to using this territorial acknowledgement for further conversation around Indigenous culture, spirituality, history, and experience. We know that the acknowledgement will evolve, and we really welcome feedback from Indigenous and non-Indigenous partners on the CND OHT territorial acknowledgement. So with that said, I hope you will join me in reflecting before, during, and after I read the acknowledgement now. We acknowledge that lands on which we gather are traditionally used by the Haudenosaunee, Anishinaabe, and Chinontan people. We also recognize the enduring presence and deep traditional knowledge, laws, and philosophies of the Indigenous people with whom we share this land today. The Cambridge North Dumfries Ontario Health Team recognizes we are all treaty people with a responsibility to honor our relations and live with each other in kinship. The CND OHT, as well as our partner organizations, uphold the initial intentions of the treaty to the best of our ability. And with that start, I'm going to turn it over to Angie.
Thank you very much, Sharon, and thank you for a excellent acknowledgement. Thank you. So welcome everybody to our 2021-2022 CND OHT Year-in-Review. And this is a celebration event. It is not a traditional annual meeting. I've been the OHT chair for a couple of years now, and I'm going to be your host today for our special event. We're missing our lunch at Fairview, so a lot of you are on video, and it is still nice to see all of your smiles in real person. And Christina, thanks for capturing that by a photo. On Friday, I think you were emailed a one-page summary that overviewed of this meeting and the strategic framework, which we're going to launch today. And all of us are here, and you can't help but work in your own silo. And of course, during COVID, we were really working on our, off your own dining room table, really in a silo. So it's going to be really exciting today to get a real overview of what the OHT is doing, and that really at its base is this collaborative venture that we launched here in Cambridge and North Dumfries. And I really look forward to hearing the accomplishments and successes, and I hope a lot of you do as well. We're delighted to have so many guests here today. I'd like to welcome the Joint Board Committee who's here, the Steering Committee who is here. Many of you come from the JBC's member boards. It's nice to see your faces as well. And of course, the Cambridge North Dumfries OHT staff support team led by Christina. I'd also like to welcome our special guests, including Mayor Catherine McGarry and Mayor Susan Foxton. It's my opportunity as well to go off script a little bit, Christina, and shout out and mention and thank all of the leadership team at our OHT office. And we are so lucky to be led by the fearless, tireless, optimistic, clever, engaging Christina Eliashevsky. Christina, your board cannot thank you enough. And on behalf of all of us, thank you very much. I know Christina will thank her team later in the program, but it is my pleasure to thank you on behalf of the Joint Board Committee. Many of us have sat on many boards over the years, and I'd just like to say that personally, the partnership, the insights, and the opportunities that you and I have shared personally, I maybe would never have had those otherwise. So I'd like to thank you personally as well. So it's been an incredibly difficult couple of years to be working as a volunteer or as a staff or in the healthcare sector, but we have some incredible successes under difficult situations. So I know Christine and the team were bursting to celebrate the accomplishments for a couple of days and for this event today, instead of just putting out fires and solving problems. So today we're going to hear key highlights in the following areas: the COVID-19 response steering committee, connecting care co-design group, our digital health group, and then some highlights from the Joint Board Committee. A highlight of our meeting today, of course, is going to be the premiere of our video, our CND OHT introduction. Following the launch of the video, Christina will talk about the strategic plan. And we're going to wrap up with a moment of gratitude. It seems that when you get together socially with people or professionally, we've spent so much time the last 2 years talking about, the upsets, the lines, the problems, the issues, the sicknesses, the terrible work experiences we're having. So we're going to wrap up with a moment of gratitude to just, remember lots of us have had lots of wonderful things have happened in the last couple of years as well. And we all personally have some things to be grateful for. And we also asked you each before you, when you signed up for the meeting, to give us some words to put into a big word cloud. And Christina and her group have put the word cloud together. And of course, the big giant blue word is collaborative. And I think that's really what that's at the base of what an OHT is. It's bringing our 18 member organizations together and to work collaboratively. And the COVID crisis proved one thing is that it worked. It did work. And we were really, really good. The other word I want to just focus in on is the little wee one in pink, and that's potential. And that just gives me such, this is our first annual success event. And I get it. When you see the word potential, you just think of how many more bigger and more wonderful things that this group can do. I know that sitting on the JBC, it's like every organization cherry picked a really interesting, deep thinker. And to work with these 18 people on a monthly basis has been really fascinating for me personally. And I see all of that potential. So I love that. So let's start things off, go right into the presentation with Chris Casolato. And again, I get to do lots of thank yous today. And I'd like to thank Chris, who along with Patrick Gaskin and previously with the retired Bill Davidson, as steering committee co-chairs, they were very generous with their time with me, which is really being then generous with the Joint Board Committee, and their leadership as co-chairs, leadership as OHT steering committee. It's just been exceptional having these three gentlemen as our leaders. So Chris, you are up.
Great, thank you, Angie. Great introduction, and I appreciate your kind words. Again, my name's Chris, and I'm the co-chair of the CND OHT steering committee, and also the executive director at Two Rivers Family Health Team. And I am pleased and have the honor to do some review of the accomplishments that we've had in this last fiscal year. So I wanted to recognize some of the key people and groups that have made a difference this year. And Angie so well described the CND OHT support staff led by Christina. I think they helped drive what we did this year. They have a great little space in Cambridge if you've had a chance to visit it. It's really inviting place, and have had many meetings there, and I really want to thank them, because with the constant changes of ministry guidelines, COVID updates, outbreaks in the community, they've had to reprioritize and shift and change their to-do lists and their tasks almost on a weekly basis. So huge kudos to them, and they've just done an amazing job. And as we've talked about a couple of times, everybody knows the big priority that we've just gone through this last fiscal year, which was COVID and the COVID response. And really want to do a massive thank you to all the member and affiliate member senior leaders who for over a year and a half met early mornings, every other week, 8 a.m. meetings to get great COVID updates, work on situational awareness and real-time collaborative problem solving. And that led to our response plan for our community with the COVID response plan as well. And that was jointly developed by 32 of our members and affiliates. So where everybody had a say and everybody contributed. And again, this was an evolving document and seemed to change every week. So thank you to everybody that we had a bit of a guiding document that helped us get through the last challenging 12 months. And I felt the most exciting part and most powerful part was there was often a challenge of the day. So whether that be people had run out of PPE, or we needed masks somewhere, or testing, or staffing to help a congregative care, a long-term care home, or some other redeployment of staff, there'd be an email that got sent out to all the members in the morning. And by 3 hours later, you'd have 5 or 6 volunteers offering to drive PPE to an office, or offering to give an employee over a weekend to help a home through a crisis. And that was just the most powerful thing I saw this year. And back to Angie's big blue word there of collaboration. I think this starting the OHT before COVID hit really was a powerful piece that allowed us, I think, to get through COVID together and help the community a lot more than if we were all strangers and we were trying to frantically get together and build that trust. So again, thank you to the leaders of those 32 members and affiliates. And finally, the steering committee. This is a dedicated group of 18 leaders that get together on a monthly basis and as needed. And our mandate is to provide leadership and decision-making to execute priorities and ministry deliverables. So a very dedicated group, very collaborative. We often, we don't really even have to vote because there's a lot of consensus. We vote a few times just to make sure everybody has a say, but it's been such a great consensus building, trust building exercise. So really thanks to all the engagement and commitment over the year. Your dedication has been amazing. So I'm proud to be co-chair of that, and I look forward to the next 12 months. And I would love to hand it over to Laura next.
Thanks so much, Chris. And I get the exciting opportunity to talk about the Connecting Care co-design group, which I always hear sparks a little bit of hope when we start to talk about this work, because it's not necessarily grounded in response to COVID-19, as important as that is, but it's really about transforming our future and setting ourselves up for success. So I would be remiss not to pause for a second and also acknowledge all of the incredible clinicians and leaders from many of our organizations represented here, as well as those not represented here, that have come together during an incredibly challenging time, an unprecedented time, to actually carve out the energy, the capacity, and the time in their day to do this work amidst multiple waves of the pandemic. So really want to acknowledge every one of you that have had representatives or yourselves sit on this group. And 5 minutes is surely not enough time to capture an in-depth picture of everything that's been achieved. But the group came together in the fall after having paused for a little bit because of pandemic-related response needs. We were able to really rebrand ourselves and align ourselves with a work structure that would create momentum to deliver on our key goals that were needed to be delivered on within this fiscal year, and understanding that we had a much smaller window of time to do this work within. We created an advisory committee that would work on more of the administrative and structural components that needed to occur. And then we were able to develop a mental health and addictions work stream, as well as a complex medical work stream, which then brought those priority populations into full focus and dedication. We agreed through our co-design process that using the foundations of population health would be the right path forward. It made the most sense for our patients and our community, and it felt like the right thing to do. I'm going to have you flip forward 2 slides there. Perfect. This looks like a very busy slide, and so I apologize. But the foundations of population health really was about understanding what our aim measures would be, diagnosing the system as it existed today, because it was very different in the midst of a pandemic than it had been prior to. The needs of our patients had changed because of the implications, as well as the needs of our caregivers and our support systems. And then through that process, we were able to understand and generate the change ideas necessary to create and establish that transformation. For our complex medical work stream, we have identified that there isn't a consistent approach to identifying and really understanding who those patients are in our current system. And so the group has done some remarkable work on developing an electronic tool that can fit right into our existing primary care EMR, our electronic medical records, and create flags in the background to support clinicians in understanding who our patients are at every level of risk. So whether they are within the healthy populations, within our rising risk populations, within our high risk populations, or our high end user populations. And then from that identification, we can start to create care pathways that will support the early identification of the needs of these individuals and get them on the right path to having the supports they need, which will prevent them from moving into those high risk and high end user segments of the population. So we're really able to get them supported with their care early on in their diagnosis and in their path along their medical journey. For our mental health and addictions work streams, we're able to identify the mild to moderate depression as an area of focus early on, because they wanted to understand the foundations of priority population and using that strategy before moving into some of the more complex areas that we knew we would need to tackle quite quickly. And so one of the early identifications was really just having access to what resources were available for this population. And so their early change concept has been working and doing a robust assessment through the Ocean e-referral platform to understand what services exist and what services are missing within that platform, so we can start to engage our community partners to actually bring on a robust picture of services. We've also created something as simple as keyword search, and they call it health service offerings, and build that out. So when you are a clinician in the moment and you've got a patient sitting in front of you in your office and you want to give them a resource before they leave the door, because oftentimes that's the most important thing, is having that resource in their hands before they walk out of your clinic, you can start to put in key word phrases like mental health, wellness, or social prescribing that will actually support them in accessing services you may not have realized were even available for you, but often are already there and underutilized. So things like support groups, friendly visiting groups, or even gentle exercise groups that will support these individuals with getting out of their homes and making those social connections that are necessary for their mental health and wellness. And so those are just 2 early change concepts that we have been working on. The momentum is growing. It has continued throughout the last 6 months. And we have a group of clinicians that are absolutely dedicated to continuing this work because they see the hope and the potential that's coming from it. And it's giving us a breath of fresh air and rebuilding our resilience when we think about opportunities for our patients, which is really why we come to work and we show up every day. It's to support our patients and our community. So I'm going to pass this on to Jeremy, who is our next speaker. And thank you so much for the time and opportunity to share this with you.
Thank you, Laura. My name is Jeremy Howcroft, and I am the CND OHT Digital Health Lead. I am seconded from the, am I still muted? Sorry. Yes, I'm seconded from the eHealth Center of Excellence, and I have been with the OHT for just over a year. I am happy to be here today to speak about the developments in the digital health realm and to highlight a few of the accomplishments seen in 2021-2022. First, I should say that digital health is referring to any application of information technology to enable integrated and efficient patient care. In most cases, it's referring to the digital flow of patient information between providers, healthcare sectors, and the patients themselves. It can also refer to something as simple as booking an appointment with your family doctor online. That's an example of digital health. It's been a very exciting year in the digital health space where we were supported by Ontario's Digital First for Health strategy and enabled by our local champions and innovators. Everything from our harmonized information management planning to progress in mapping patient navigation supports. It was difficult to select which accomplishments to highlight for you today. To start, I have to thank the CND OHT for its partnership with the eHealth Center of Excellence. Next slide, please. This partnership resulted in being a trailblazer, the very first in creating a model of OHT support for digital health that is being replicated by 10 other OHTs today and growing. Together, we have demonstrated the value of embedding digital health expertise into the OHT's staff support team to represent the OHT at digital tables, guide the digital health strategy, and facilitate its implementation. It's exactly the sort of thing that the OHTs didn't know that they needed. Next slide, please. We were then able to look at how digital health fit into the governance of the OHT, which led to one of the biggest changes of the year. Supporting the idea that digital health was going to have an important role in achieving most every goal of the OHT, we shifted the structure of the digital health co-design group to one of an integrated model of enablement. This ensures that progress made in the digital health space is driven by and in close alignment to the clinical needs and projects of the OHT. A great example of this was working with the Connecting Care group to develop the EMR tool that Laura just spoke about, as well as facilitating the relationship with the provincial e-referral program that did the amazing work in evaluating the current state of mental health and addictions resources that are accepting electronic referrals. Next slide, please. We've also been able to nimbly assess the many funding opportunities presented by the Ministry of Health last summer. CND OHT was part of 6 proposal submissions, and all 6 were approved for funding. This resulted in more than $330,000 coming into our community, supporting projects like improved surgical transitions, reducing the length of stay, improved secure communication between healthcare providers, and more primary care offering online appointment booking to their patients. Next slide, please. On the topic of primary care, and in addition to the funding we just spoke about, we were able to provide even more financial support to more than 60% of primary care providers in Cambridge and North Dumfries. This support was a reimbursement for investments made in the digital health space, enabling greater patient engagement through secure messaging, electronic forms, online booking, and more. It shows our commitment to this important pillar of providing truly integrated healthcare in our community. I'd like to thank everybody for listening. And finally, I'll turn things back over to Angie for a joint board committee overview.
Thank you very much. Both Jeremy and Laura, thank you very much. it gives you hope when you hear, again, progress moving forward and from the passion from both of the leaders of these co-design groups. And for our guests here today, the co-design groups are, this is work that would not have been done without the OHT. It is because there's an OHT and because we can organize it and fund it that projects in mental health, addictions, older adults and medically complex, digital health solutions, electronic medical records, it's simply because of the OHT's existence that that collaborative work is getting done. So I applaud the work that they're doing. It's really exciting, even at this early stage. Secondly, I have to apologize. I missed some very, very important people, special people who are in our meeting today. And I would like to highlight that on very busy days, I'd like to thank Karen Redmond, who's the regional chair, for joining us, and also Chris Bannerman from Ontario Health West, who is also joining us. So I'm sorry that I missed you in my introductions as our special guest earlier. So from the OHT, the report from the Joint Board Committee, this past year has been time, and we keep talking about the past year. I really feel like it's been 2 years that we've been working together, but we finally, it was last year when all this stuff came together and stuff got done. But it really was a time of building relationships and building a common vision, and for people finally getting it and getting what we're doing and seeing some things that we could do. So I'd like to express my appreciation to all of the JBC members for their commitment and their enthusiasm for what we're doing. This year, the JBC made progress in building our governance approach. It's hard to sit as a group and not have that big binder that we all get when we join boards. So we're finally getting some of that together. We launched a governance accountability working group that has been established, and it continues to develop our OHT policies. This is not the most glamorous of work. It is not my favorite work by far. So I really do thank the people that have stepped up and helped writing the policy. And it has strengthened how we work together. It supports transparency, and it supports the integrity of the organization. We also establish regular reports to ensure that all the member boards and directors receive regular updates on the work of the OHT. We thank our boards for their ongoing engagement and support. We started with 18 boards. We have 18 boards, yet we have applications to grow. No one has found that they want to leave. They all know it's that the advantages of being a part of the OHT and the Joint Board Committee is really working for their organizations. We were an active stakeholder in the development of the strategic plan that will be launched today. And we oversaw the process, and we participated in shaping the strategies and the priorities, and did approve the plan just at our last meeting in April. One of the key areas of opportunity that we identified in early 2021 was the need to help our communities understand what the CND OHT does. And I know that even the first year as the chair of this group, of the JBC, I didn't really get sometimes what the OHT does. And that's where some of the governance helps that. But the community, I'll say to my friends, oh, I'm the chair of the JBC for the Ontario Health Team. And they go, like, they don't even know what that is. So we did approve a vision statement in the fall to help introduce ourselves to communities. And we know that images and stories are far more interesting and powerful than words. So with the help of a local production company, we developed a short video to introduce ourselves. And watch closely, you'll see some of us there. So Hava, please, will you share the video?
The Cambridge North Dumfries Ontario Health Team is made up of many service providers and agencies from Cambridge, North Dumfries, and Waterloo Region.
We will reorganize and deliver healthcare in a different way for our communities, working together as one team to deliver
hospital care,
primary care,
long-term care,
rehabilitative care,
addiction services,
mental health services, and more.
We are building integrated care systems that provide seamless, fully coordinated community care to achieve better outcomes for patients and improved health for all.
Inclusive, accessible, adaptable, connected. We envision a community where people access seamless and integrated services to ensure the health and well-being of our diverse populations. Your Cambridge North Dumfries, Ontario Health Team.
And that is the premiere. I feel like I should leave my office down a red carpet or something. Thank you very much to the team from The Blend, our local production company. So thanks again to many of you that I'm seeing your faces here, that are leaders and community members who participated in the video, and Hava, who coordinated this whole project. And I'm going to give Hava a special thank you for stepping up as our acting transformation lead over the summer as well, last summer. Hava, you did a great job. Starting today, the video will be available on our YouTube channel, and we invite our partners to share it maybe at your next board meetings, so that, again, your board members will understand a little bit more about what the OHT does. You can also share it with your friends when they say, what the heck are you guys doing? What's that you're doing every month? So we can do that as well. So let's get everybody as excited as we are as we get to be a part of the work of the CND OHT, and work that's moving forward, not looking back at the COVID work. So Christina, the floor is yours to talk about your team and the work you're doing behind the scenes.
Fantastic. Thanks so much, Angie. I thought I would get that background music for my piece as well as you started that off again. Really want to thank Hava and those involved in that video. It's a hard act to follow. Angie, really want to thank you for your leadership today and for your support over the last year. Big thank you for being a phenomenal mentor, and I appreciate your leadership on what can probably be best described as a challenging year. For those who may not know me, my name is Christina Eliashevsky, and I'm the transformation lead with the Cambridge North Dumfries OHT, and I think proud to say maybe the first staff person employed by the CND OHT. I also, as I'm acknowledging folks, want to take a pause to acknowledge the leadership of the CND OHT Steering Committee co-chairs, so Chris, who's here today, and Patrick, for their phenomenal leadership and mentorship. And as we look ahead, want to take a pause certainly to acknowledge our staff support team. So I've written every name down so I don't forget anyone. I want to thank Brenda and Hava, who are the masterminds behind today's event. Jeremy, our digital health lead that you heard from, Alexis, who is our IPAC lead, Lindsay, who's one of our newest additions to our team, our performance monitoring quality lead, who jumped right in. And we have 3 students with the CND OHT. We have Brenda, Mimica, and Mackenzie. We're a small but mighty team, and want to thank every single member of our staff support team for your enthusiasm and your passion that contributed to our successes and achievements over the last year. I also want to acknowledge those who are doing this work on the side of their desks, and in particular, our co-design group co-chairs. So Laura, thank you so much for leading the Connecting Care co-design group with Erin. Sharon, really want to thank you for your leadership on the quality co-design group. And Lyra and Danica, thank you for supporting the work of the digital health area. So we look forward to continuing to communicate the work and the impact of these incredibly engaged groups as we launch into the 2022-2023 fiscal year. One way we'll be communicating updates to you and our communities is through our redesigned CND OHT website. I am so pleased to announce that today we are celebrating the relaunch of the new site that will be going live later this week. This site will act as a hub for you and your teams and our communities to engage in our work going forward. The new interface is especially easy to navigate, and it even includes a member directory as well as opportunities for meaningful two-way engagement. We look forward to you visiting soon and appreciate your support in sharing the news about this new website with your networks as it launches later this week. The website will house one of our most exciting accomplishments to date, the CND OHT 3-year strategic framework. This plan has been designed and developed with the support of many stakeholders, including community members, clinicians, members, affiliate members, and our joint board committee, and it's the culmination of dozens of engagement sessions. We heard from you and our stakeholders that we need to, 1,
focus our efforts. 2, continue to build on our successes. 3, address the inequities that have been uncovered, particularly through the pandemic. And 4, take care of and enhance the health and social service workforce. So with that, I am so delighted to be able to share with you and launch the CND OHT Strategic Framework. Hava, if you can pull it up there, thank you. So the CND OHT Strategic Framework demonstrates our collective commitment to the values, as you heard in the video, of being inclusive, connected, accessible, and adaptable. Our strategic framework centers around 4 strategies. At the top there, you'll see we have a cornerstone priority. We will transform the healthcare journey. This will be our focus of our collective efforts over the next year and the next 3 years. We will put patients, families, and caregivers at the center of a redesigned healthcare experience. We will improve care coordination across our partners, and we will reduce barriers in access to care. Our strategies also include 3 transformation enablers. We will innovate, learn, and continuously improve. We'll advance reconciliation and foster diversity, equity, and inclusion. And we will enable the full potential of our health human resources. The strategic framework will act as our North Star, guiding and focusing our transformation efforts over the coming years. We will use it to ground the work of our various committees, of our co-design groups, and it will be the foundation of establishing a performance monitoring strategy for our OHT to track and report on our progress and effectiveness. Over the coming months, we will build out these strategies by co-designing detailed work plans and key performance indicators. The next year of OHT activities will continue to move us closer to our vision. Some of the key activities planned for the next few months that I would like to highlight include hosting a Connecting Care co-design virtual retreat at the end of June, which will help us re-energize our care transformation efforts related to care coordination and care navigation. We will be announcing new CND OHT members in early July and onboarding new members of our steering committee and our joint board committee in early September to enhance and strengthen our governance. We'll be implementing diversity, equity, and inclusion and reconciliation training sessions for our CND OHT staff support team, as well as our steering committee, joint board committee, and other stakeholders. We'll be doing this in partnership with Wellbeing Waterloo in the next 6 to 8 months. We'll be launching the CND OHT Patient, Family, and Caregiver Council in September. And finally, we'll be launching a revitalized, robust, multi-pronged primary care engagement strategy in September. We're confident that the CND OHT strategic framework and accompanying work plans for the next year will contribute to reaching the CND OHT vision. And we look forward to continuing to engage all of you as we bring this plan to life to continue to improve the well-being of our communities. We have a thrilling year of work ahead. Thank you all for your continued collaboration and support. Angie, back to you to wrap us up for today.
Thank you, Hava. Thank you, Christina. I'm looking at Hava and talking to you. Thank you, Christina. And we're going to just have share some moments of gratitude. One thing that we're going to start with is gratitude is this group never runs over long. When we say we're going to be done in 45 minutes, we're done in 45 minutes. So we all have gratitude for that. But when you were invited to this meeting and when you RSVP'd, you were given an opportunity to share a moment of gratitude as a pre-activity. And I would like to leave the meeting with, again, and it's so easy to crab, but it's a lot harder to say thanks. So let's just share some of these moments of gratitude. And again, we can highlight a couple of things. And if anybody in the chat would like to just do a couple of highlights, because we are certainly running on time, but colleagues become friends, colleagues become a little bit of sunshine on some dark, dreary days. And I would like, again, I feel that this became a very collegial group. I'm sad that we're not in person, but we will be in person soon. You know, I think we all can feel grateful that maybe there's a light at the end of the tunnel and we're no longer in crisis. And that some of our care providers who, you know, at personal crisis are maybe going to be able to take some moments for themselves in the next, or have, or in the next couple of months, and recharge the engines and get back on their feet again. We all, I think, again, here are in the healthcare sector, and we all know lots of people that have had extraordinarily mental health struggles with COVID, and hopefully, again, looking at the resiliency of our community, that we can move forward and with some care and service and friendship with that, and a little few acts of kindness. So it'll go a long way. So having said that, and seeing nothing further in the chat, if you have any questions, please reach out to Christina. There's a nice thank you there from Sue Inchspessis, Sue Foxton. And thank you very much for people. And just even reading these comments will make some of our staff and volunteers all feel that they're moving forward. So thank you very much, everybody. Christina, although it's not a formal annual meeting, I'm going to call it, I'm going to adjourn the meeting.